Nez here. Like to give information to everyone regarding the COVID-19 uh, pandemic as of November of 2022. So before we start, let's pray. Pray for the nation and pray for our people. Idian God, yot edichin kwa inanakain lagi ba kenitsin. Ara alt kon khandad lishigi kon diche ya bedeitni to batsudilsin. Ara zel indan lengi tsuladan lengi alt kodoshi ya betonlon ole alt kon hik enig inna. Tis bichenda has titla tlae kon hik enig inna hitsa da jiddan أكيد lengi bilo betonlon ole shni yot edido de kosen skagina hast etsata. Nasnigi nachin kodili shri yot the monkeypox that the Diego the Ishni Ada Bikija ya Del Nesto Zeto Bahadlo Ishiko a head and he need of the Ishikodo he can in Lana Badanits and Hada Seto Zebikijana Nishigi Hota Con Zel Endan Denigi in Denito Konik in Bada at se Bada Sishing La A by Henits and other quado Nha in Lagido by Henits Corona at Adonat Kini Ikani never to the Nagi ye dapat seal or that oh yeah that's need or that shit to the yot a con so she anil con so the zinche be had that seed or that ship ni but not out or that Jesus name amen. Good morning everybody. Just starting off with prayer as we always do here uh, during these meetings. The U.S. and the Navajo Nation are still in a public health emergency declaration. We cannot forget that. And with the monkeypox spread as well, we are doing our very best to, push back on these new viruses that are coming in. We will continue to take those precautions through our safety guidelines. Of course, they're issued through the public health emergency orders for the general public and the schools. As we continue to see variants of the new COVID cases weekly uh, and hospitalization, we remain the course in protecting ourselves. So the virus is still here, but the protocols that are going to be shared with you, the new public health emergency orders, are going to do a few things. We're updating the mandate to wear masks in indoors, including schools and businesses. That's Public Health Emergency Order 2022-009. The Public Health Emergency Order number 2022-010 is Public Health Emergency Order reemphasizing safer at home order and updating gathering limits. So those are going to be reevaluated. Dr. Jill Jim will have a little bit more information on those. And as we see vaccines coming into the Navajo Nation, we encourage people to get vaccinated, get your flu shots, get if you're in that most vulnerable population, get the monkeypox vaccination. We're going to have this Saturday, November 19th, in Pinon from 9 a.m. to 2 p.m. The drive-through vaccination for COVID-19, including the flu vaccination or the flu shots. Chinle on Saturday, November 19th from 8 a.m. to 4 p.m. If you haven't got your updated vaccination, COVID-19, there's your opportunity to do so in Pinon and in Chinle. And again, we want to appreciate everybody that's on the call today and viewing the WebEx or the Zoom. We want to continue to encourage our Navajo people to stay the course. Holiday season is coming up. So if you have someone in the household that is in that most vulnerable population category, that's people with health issues or elderly, we got to continue to make sure that they are safe. And to do that, wearing masks indoors at our family gatherings is very important. Remember, 2 years in a row, you know what happened. The increase in cases after the holiday season. We got Thanksgiving coming up, Christmas coming up, and New Year's as well. New Year's is a big social gathering as well. So please tell your family, your friends, and the community over the holidays to stay the course, please. And there are boosters that are available. Keep continuing to get your booster shots. We encourage that. Go to your nearest healthcare facility to get the schedule of vaccination. Sometimes you don't need uh, a schedule. You could just go in and get your booster shots as well. So thank you to the Dr. Jill Jim, Navajo Department of Health, Epidemiology Center, also the IHS and the 638s for doing an outstanding job for the Navajo people. So stay the course. Ada hasyado ko the question skagi na states at the hazeb kitchena and the shigi ya andi dahalo. Aron the khada seti the mo yajigo na ainle pinyan the do chinle the kaho at the mo yajigo Saturday being go kisado sana ano bikitche. Asian hot out a ya Gijo but the any kid the shni khada at se jo ato di the question skagi ato nache is nita even nache ekon da hasiado skeda I aro keshmish yaji no keshmish aro na kha jo kut a ikon keni hinna asahanda atle da do aro asahanda itlegi ben nache da hasia Tony masan yichain hinale tashi honi keni hinna it's east which end has tea edo ba da hasia your master das edo hand sanitizer chudas aro your masan yichain hinal nasa zlengi do edo ba da tashi keno thini atotsko chinsni da di konsentragna hast it's at da even in ai koro hanan hije kondel aro koni do not so spell na asli Eishi kodo Dr. Jill Jim so uh Adainos nido that's in Chicano Fini. So Kotsoshi and then Hichikona de Liado left teacher Jonathan is president of the Navajo Nation. So thank you so much for tuning in. And I'll turn the time over to Dr. Jill Jim.
Thank you, President, and those listeners on the call this morning. Dr. Jill, Jimmy, and Shiedo. Donna and the Sunday look on the song touching the buses chain door, a shame, just a chain door, it was a fun day, does another. Other is by her young day, because then she ain't door. Or she here and get in the door, Aquid, na kick on that in this or not, how, the what on the announcement see put it in one day doshi not on the public health emergency orders number 9 and 10 also on the initial die what not was we signed those documents. So and as he mentioned, kasi balagana we are still in a public health emergency, as President mentioned. We just want to make sure that we are slowly transitioning to the new normal of COVID. And I think we've been saying this for some time regarding how do we handle COVID, how do we address COVID, and for a very long time, we talked about COVID fatigue. Everyone just very tired of COVID and just it hasn't gone away. And so we are seeing fluctuations in our cases. We are seeing hospitalizations fluctuating as well, but we are seeing fewer deaths related to COVID. And for those reasons, as we're monitoring, we are lifting restrictions. So there were restriction limits in the orders regarding like indoor and outdoor capacity, seating area capacity limits in schools, or if for trainings and meetings for the wellness centers, those have been all lifted. And the only thing that we are now encouraging everyone to do is still have an indoor mask in the public. So that means in grocery stores and stores and schools and businesses and hospitals and tribal programs. So those are in tribal government. So that's the only requirement that's sort of still out there. So we want to make sure that we address this. And I know Dr. Gaines will probably talk about the RSV and other respiratory disease viruses that we may see or are already experiencing here on the reservation. So sort of these prevention measures are going to still be important. There will be updated COVID-19 safety guidelines that will be posted along with the school safety guidelines as well. And those are just precautions. We encourage individuals to avoid crowded areas. That's sort of our physical distancing measure now. There is no particular 3 or 6 feet. We just encourage everyone to begin and continue to be aware of your surroundings. And then especially if you're sick, people may not really know too. And sometimes we take all the precaution that we can and we still get COVID and we don't know why. So sometimes I always hear that I have a vaccine or I tried my best, I wear my mask, I did everything that I could and I still got COVID. And that's really a lot of the unknown that we still want to encourage people to think about that. And just, I always say like we can't feel it, we can't touch it, we can't smell it. It's a respiratory virus. And so it's always best to just still do everything the best that you can. And sometimes we let our guard down, and we might be coming together for birthdays or for holiday parties going forward. Just a little bit, be cautious, and then for those that are asymptomatic, they might not know, and that's just a really unknown part of COVID as well. Some people are not going to show any symptoms, and they might not be coughing, they might not be sick, and they might think, oh, okay, well, I just have allergies or I might have the cold or flu. And so we're in that situation right now. We're seeing different types of respiratory viruses. And I think that's why we just encourage everyone to take precautions, and especially in your own households during the holidays as well. So begin preparing for that. If you don't know if someone might be asymptomatic, COVID test kits are offered through the CHR office as well as health facilities and as well. So just know that there is availability to still get COVID tests, home test kits as well, to sort of take as a precaution as well. And then just have open ventilation available as well. So just begin preparing for your holiday gatherings. And it's just going to be important, especially if you are sick, do not host a party or do not do anything, because you're likely going to transmit, if you're not very careful, any sort of respiratory virus that's out there. So take care of your families and your kids, and especially our elders. So and it's really not over. So actually, and I know pneumonia and bronchitis are things that are still around and could result from some of these respiratory viruses too. So taking all of those in precaution and understanding with your family members, you might have to continue just to stand your ground to make sure everyone's safe. She opa the sino that the thought we're very protective and very thankful for all that you do. So as we continue to address COVID going into the winter season, and maybe we won't experience a surge if we just continue these precautions. So let's see what the data shows us, and Dell will probably give us some more information on that. So actually, so I'm going to hand it over to Dr. Gaines. He's with the Navajo Area Indian Health Service, so, and also a very critical member with our Health Command Operations Center. So Dr. Gaines, I know you can elaborate on some of the stuff that I talked about and what you're seeing in the facilities as well. So take it away, Dr. Gaines.
All right, thank you, Dr. Jim. So good morning, everybody. So on the COVID front right now, we are seeing a positivity rate across the area right now of 26%. At our federal sites, we do have a handful of individuals currently hospitalized at the federal facilities for COVID. But one of our bigger challenges right now are the other viruses that are circulating in the communities, including both flu and RSV that Dr. Jim mentioned. RSV is a respiratory virus, typically in our young children. Children under the age of 2 are at highest risk of needing hospitalization when they become ill with COVID. And right now, this week, some of our facilities have had to look as far away as California, Texas, and Oklahoma to find beds available for our pediatric patients because the entire Southwest hospital system is full right now at capacity with pediatric admissions from RSV. So certainly if you have young children at home, I encourage you to try to keep them as safe as possible and away from individuals who are currently sick to reduce their risk. Certainly we're doing what we can to try to increase our capacity, but that's very limited. And if at all possible, we'll keep as many of those children in the area as possible. But we have had to look out, unfortunately, quite some distance to be able to find open beds for our pediatric patients at this point. So the same precautions for COVID work very well for both flu and RSV. So masks, social distancing, hand washing, all those things are very effective. And in fact, probably more effective for RSV and flu than they probably are for COVID. So continue the same precautions you've been doing for COVID, and that's the best thing you can do to protect you and your family and those around you from RSV and flu as well. We have not had any new cases of monkeypox in over a month that I'm aware of, but we do still have vaccine available for those who qualify in the high-risk categories. And we certainly are giving out as much flu and COVID vaccine as we can to those who are willing to get that. So all our medical facilities have those available, and there are community events going on throughout the region. So please find one of those and get updated on your immunizations if you've not already done so. Thank you.
Hey, thank you, Dr. Gaines. So Dell is also our epidemiologist, and he goes over our gating measures and updates. So Dell, do you want to go ahead and pull up your presentation? Thank you so much.
Okay, sorry. Good morning, everyone. Thank you all for joining us. Hopefully you can hear me. I'm just going to go over very briefly the latest COVID numbers that we have on the nation as of November 10th, which is last Thursday. As you all probably know by now, we are doing weekly updates now. So we transitioned from daily updates to weekly updates. So as of November 10th, last week, this is our recent weekly cases and trends. As you can see, this is over 8 to 9 weeks, about 60-day time period here, going back to about early September 11th, all the way to last week. So as you can see, the bars, these are weekly case counts. They do continue to vary each week, but you see a little bit of an increase in cases over time, especially more recently. So that's our situation as far as weekly case counts. Core metrics, this is our Navajo Nation new cases per 100,000 people in the last 7 days. So there were 430 our case rate is 430 cases per 100,000 people. That's continues to be a high 7-day case rate for us. Percent staff beds occupied by COVID patients is about 10%. And according to our gating matrix, that's high risk currently. We'll try to also continue to monitor this with our new update that will come out tomorrow. So, and then new COVID hospital admission rate per 100,000 people is at 1.31 admissions per 100,000 people, and that's still at medium risk. Other additional metrics here, there were over a 7-day period, 681 new cases, which was a minus about 6% change from the previous week. So we did see a little bit of less cases from the previous week's report. Our 7-day lab-based test positivity is currently at about 26%, and this is excluding all the home tests. And so hospital capacity or bed occupancy, 5-day moving average for regular hospital beds is at about 60% as of November 9th. And then ICU beds at about 75%. And then vaccine coverage here, vaccines are still being administered currently. As President Nez mentioned, there'll be an event apparently occurring in Pinyon and Chinle over the weekend. So we continue to encourage our people to get vaccinated, especially with the latest booster. So 70% have completed the primary series, which is as of October 28th. There's a new report that came out yesterday. So we'll be including that in our new report going out tomorrow. About 10% are up to date. That's with a new definition of the bivalent booster according to the CDC. And then our COVID strain surveillance continues. I'll go over that a little bit in more detail in a little bit. Here's our vaccination chart. Navajo Nation residents only. There are 130,910 Navajo Nation residents who have completed the primary series. And then about 20,000 are up to date. This is the epi curves for the entire pandemic for the Navajo Nation in blue, and then the United States in red. So our numbers, as I mentioned, continue to fluctuate every week. So as you can see here, the blue on the right side of this chart goes up and down, and with the less cases we saw with this report, a little bit of a downward trend here. We'll just see what the new report looks like tomorrow. Our 7-day case rate, we did see less cases, but our 7-day case rate remains really high compared to the other 50 states. And New Mexico as well. Just want to mention our neighboring state, New Mexico, seeing a lot of increase in COVID cases currently, even this week. I looked this morning, so just there's a lot of still COVID cases occurring within our region. As you can see here in New Mexico, the darker shaded blue color with a high 7-day case rate compared to the other four corner states here. COVID transmission, community transmission remains high, especially within our region. All the counties within, Navajo Nation are still in red, meaning high COVID transmission. And then this is our latest COVID strain surveillance report for Navajo Nation as of November 7th last week. So just one highlight here is where the BA5, the Omicron sublineage, which includes the BF.7 and the BQ.1, are still the predominant variant, still being detected on the nation. It went from 510 cases to 538 with the new report. So the BA5, especially the BQ.1, it continues to be seen across the U.S. and we've detected the BQ.1 in September. So we're really closely monitoring this BQ.1 sublineage of the BA5 Omicron variant. All the facilities are continuing to participate in our COVID strain surveillance across the nation. And as I mentioned, this BQ.1 is beginning to emerge on our surveillance of the COVID strain surveillance. And then here's the US. Just a couple of highlights here is as of November 5th, the BA5 continues to fade. Omicron sublineage is now at about 40%. It used to be up at about 70, 80 percentile, just like about maybe a month and a half ago. So each week it continues to go down. So now it's at about 40% here. And then the other sublineages here, the BQ.1.1 and the BQ.1 continue to increase at 18% and about 16% for both. So we'll just continue to monitor that going forward. And then last is our high transmission chapter list here with the 51 new chapters making the list. Just this as the number of chapters also is beginning to increase each week. The previous week was, I think, 45 chapters, and this week is at about 51. So this green section here on the left, and then going to the right is going back in time, going back to about 6 weeks. These 16 chapters have been on this list each week for at least the past 6 weeks. So that's our latest COVID situation on the nation, and we'll be updating the new report tomorrow. So I'm going to stop here, and I'm not sure who's next. I think I might be the last one. So I think we're going to end here, and thank you all for joining us. We'll probably do another town hall next week. So thank you all. Be safe. I'll talk to you later.